Located where we are, we get to interact with a lot of different types of patients and lots of different types of healthcare providers as well, physicians, nurse practitioners, nurses. So it's really nice to work with others towards caring for other patients.
His ability to teach and be understanding and patient, even if I'm sure he's busy over there, and I call in the middle of the day to ask for something, he's very patient. I have never heard a bad thing about him. Everyone has always said he's so pleasant to deal with.
He doesn't seem to waver on anything that's difficult. He takes it on and he basically says, you know what, we can make it work. Normal pharmacy hours are 9 to 5. Sometimes just on the weekend, but he's made himself available. If I need something, I give him a call on the cell, and within minutes I get a phone call back.
Instead of shying away from things or just seeing this as a duty to be done, he really steps into the role and is above and beyond helpful.
Jas is just different in the way that you can just call him up and he's readily available to chat with, and he always has medications ready within 20 minutes if need be, just always on the ball.
A lot of our patients are not people we're actually dispensing medication for. Like I said, they're just walking through the hospital. They see a pharmacy, they see a pharmacist, they just want to talk. So they'll come in and just talk and ask questions. So a lot of my time spent just talking to patients about conditions, medications that they're not getting from us, but they just have questions regarding.
Well, Jas has been a really great supporter of the MAID service here in Penticton, as well as our surrounding communities in Oliver, Soyuz, Kiramias, and even Kelowna patients.
Before Jas came here, we used other community pharmacies, and it was really hard to access MAID kits in a timely way. There was only certain pharmacists that could sometimes get it, days delay. Since Jas has been here, it's consistent. I know I can access MAID kits whenever needed, and he's also trained his other staff that have joined him to be able to dispense those kits to us as well.
With palliative patients, it is different. It's all about symptom management, but these patients do need help. If their symptoms aren't controlled, they're having a very miserable time. So with us, we try to, it's not just about managing the patient's symptoms, it's about managing the family as well, and their caregivers, because everyone's in a delicate state at that point.
Working here in the hospital, it's not just my own interactions. I often come by to deal with him for some other patient matters, but see him interacting with other patients, you know, when he's giving flu shots or giving advice, and he's always very kind and patient, and always willing to lend a smile to people, and I think that is hugely appreciated in our busy world that we live in these days.